Welcome to Olympian Water Testing, giving you the best in water analysis. Today we're looking at the New York State Department of Health, and we want to understand how heavy metal surveillance is done in the metals registry. So first of all, what is the heavy metals registry? So the New York State Department of Health Heavy Metals Registry, also known as HMR, is a tool for surveillance of adult exposures to lead, mercury, cadmium, and arsenic. And these metals are widely used in the industry and all have the potential to cause illness due to either acute or chronic exposure. Examination of registry data can identify exposures in both communities and workplaces, thus allowing for early initiation of measures to help prevent exposures and potential illness. And it was established in 1980 under Parts 22.6, 22.7, and 67. It was added to the State Sanitary Code as well, and authorized by the Public Health Law. And reporting to HMR began in 1982. Now, the department receives reports of all blood tests performed on New York State residents, along with reportable levels of mercury, arsenic, and cadmium. Once reports have been received, registry staff conduct interviews to determine the sources of exposure for those heavy metal levels exceeding certain threshold, which may vary by metal and gender. And when the threshold is exceeded, information is provided to expose individuals and employers on reducing hazards and eliminating exposure. Where it appears that family members, especially children, may have been exposed, recommendations are made for reducing exposure, and the local health department is contacted if applicable. Also, what's required to report the heavy metals registry and what metals are reported. All clinical laboratories, physicians, and health facilities, both in New York State, performing tests for lead, mercury, arsenic, and cadmium on individuals residing or employed in New York State, must report the results of the test to the Department of Health. For cadmium, mercury, arsenic, those test results are listed below to be submitted, and all blood lead results, regardless of level, are required to be reported, and the following levels of heavy metals in blood and urine samples are reportable to the Department of Health. Lead, blood, all are reportable or above. Cadmium, we have urine as well. Mercury, and blood and urine, and arsenic. So what happens to all this information? It's confidential, and the records and computer files are maintained in accordance with regulations concerning medical data and concerning personal information. Access to data by anyone other than HMR personnel is restricted to ensure confidentiality is maintained. So what information should the report contain? Patient information, including but not limited to name, address, phone number, birth, gender, ethnicity, and exposure to diagnostic information. And you can actually find more information on heavy metal reporting from laboratories that report heavy metal test results electronically or manually through paper forms. Now, some interesting things to take a look at as general information as the heavy metals. What are they? The mercury, cadmium, arsenic, and lead. And why are they dangerous? Because they can harm various organs. So this is a useful service to see if you've been exposed to heavy metals, what you can do, and where you can report it. But to take a preventative measure, it's always a good idea to test your water for things like arsenic, cadmium, mercury, so you don't have to report high levels in the first place.